Okay, but this is the title, Epistemic Trust Injustices and the Psychopathologized. This is the program, the structure of the talk. Okay, so epistemic trust injustices. I think to get a first grasp of this idea, I wanted to start with a story. No. Right. So, and this is probably familiar to everybody. So this story of the boy who cried wolf, the original version is from Aesop. So it's this situation where there is a boy shepherding sheep. He's sort of bored, or he just thinks it's funny to cry wolf. So all the villagers come running to help him defend against the wolf. Right. But there is no wolf. He's been lying. He does this a couple of times until there is actually a situation where there is a wolf, so he cries wolf, but nobody comes to help him, right? Because the villagers think he is lying again. And this is a sort of story that comes up again and again in literature. There is also this version of The Girl Who Cried Fire by Hilary Belloc. It's in his cautionary tales. So these were sort of pretty gruesome moral tales for children, popular in Victorian England. With lovely titles such as So Jim, Who Ran Away from His Nurse and Was Eaten by a Lion. And there's also Matilda, Who Told Such Dreadful Lies and Burned to Death, right? So in this version of the story, Matilda is alone at home and bored, and she cries fire. So the firefighters come, the neighbors come running, but there actually is no fire. And then one day she's alone at home, she cries, and then there actually is a fire. She cries fire, but nobody comes to her rescue. So little Matilda burns to death and the house burns down. And so the moral of these stories is usually taken to be that if you lie to people, nobody will believe you, even if then you tell the truth, right? And the idea of epistemic trust injustices, sorry, my screen is doing weird things, is sort of looking at this from the other perspective. So from the people that are being lied to and who then don't trust in the information once they get through information, because of this history of lying by the speaker. So, right. So this is Heidi Graswick, and she introduced this idea or developed this idea of epistemic trust injustices. And these can arise in situations where someone provides us with true information. This information is important to us, but still we fail to acquire knowledge here in the situation, because of a history that gives us reasons to distrust the provider of this information, right? And Graswick discusses this in the context of public distrust in science, arguing that sometimes, based on the histories, such distrust can actually be reasonable, even if it might look very irrational at first, right? So people distrusting actually good and valid and useful scientific information. And then it can obviously also be very costly to the people distrusting the science. So in examples she gives for this, so for example, indigenous people distrusting science, or high levels of distrust among Afro-American communities in the medical system, for which she says there are good historical reasons, but it still makes them lose out on actual medical help, right? And this can take us beyond a deficit model of public distrust in science, where the fault sort of always lies with the public being irrational or stupid or lacking in education, so they don't understand the science, because sometimes this distrust might actually be rational. And so I wanted to see in this talk, sort of explore whether this idea adds up and how it might apply to psychiatry. So we might think of this in terms of like public distrust of psychiatric science or psychiatric practices, but also in terms of more general experiences of people diagnosed with mental illnesses. So this idea of epistemic trust injustice is basically just a combination of epistemic injustice and trust. And so I've called the talk, Epistemic Trust, Injustice, and the Psychopathologized. And this term, the Psychopathologized, is from a paper of Bernard Knox. So he uses it to refer to people being diagnosed with a mental disorder. And he uses this because he wants to be neutral with regard to whether this is actually a good thing or a correct diagnosis. And this is the background of that is, I think, the neurodiversity debate, where sort of autistic people from autistic communities and other mentally ill patients, so I'm making the presumption there already, argue that they don't want to be pathologized, but they want, or argue that conditions such as ADHD or autism are just sort of normal human variants. So this term is supposed to be neutral with opposed to that debate. I've had some second thoughts about using it after I called the talk like this, but yeah, so I'm going to run with it for now. Okay, so right, so one central component of this idea of epistemic trust injustices is epistemic injustice. So I will say a few words about what that is. This concept has been introduced by Miranda Fricker in her seminal book from 2007, and has started sort of very rich research field. So epistemic injustice basically consists in undermining someone in their capacity as a knower. And for Fricker, this comes in two basic variants: testimonial injustice and hermeneutical injustice. And testimonial injustice, so epistemic injustices in general are rooted in power relations. Testimonial injustice is when we assign less relevance or credibility to someone's judgment. So less credibility than it deserves because of prejudices we have against the speaker's social group. Right. So I might think that people of this social group, I don't know, like non-Western immigrants or women or something like that, tend to be less intelligent, or they tend to be less honest, something like that. So I don't really believe what they are telling me, right? Even though they actually know what they are talking about and are being honest. This kind of epistemic injustice is usually agential and transactional. So it happens between two individuals, usually, and it concerns particular communicative episodes. But there can be more structural forms of this. For example, when it takes a preemptive form, where there are structural or systematic reasons that exclude certain people from testifying. So for example, this would be the case if people with mental illnesses or with diagnosed mental illnesses, okay, or the psychopathologized, are formally excluded from serving as witnesses in court proceedings or other legal contexts because they are considered to be unreliable or incredible. And testimonial injustices involve a variety of epistemic and ethical harms. So obviously this creates epistemic problems because certain people, if this happens a lot, are not able to transmit their knowledge to others. And this might cause the public to lose out on a lot of knowledge. And ethically, Fricker says the primary harm is that it undermines the speaker in their capacity as a knower. And this is a capacity that we usually take as something that is very central to our humanity. And then there might be lots of secondary follow-on harms. So if people tend to disbelieve you or think you are sort of incompetent, and this happens persistently and across all sorts of social contexts, it might lead to a loss of epistemic trust in yourself and loss of confidence. And there might also be very concrete consequences of that, like career deficits, economic hardships, incarceration, and so on. Okay, and then the second kind would be hermeneutical injustice, which Fricker says is the injustice of having some, sorry, I don't know why this happens. Like this, it will take a bit longer than 45 minutes. Okay, so hermeneutical injustice is the injustice of having some significant area of one's social experience obscured from collective understanding, owing to hermeneutical marginalization. And examples she gives for this would be, for example, sexual harassment. So being sexually harassed before this concept exists, right? So let's say as a woman in the 1950s, because you have no concept for it, it's difficult for yourself to understand your own experience and why you feel like there is a problem in the situation. And also it makes it difficult to communicate the problem to other people. Or another example is suffering from postpartum depression before this diagnosis and the concept was around. So understanding your own experiences, in this case, after giving birth, and communicating it to others without just sort of ending up being seen as a bad mother becomes very difficult. And for Fricker, these are sort of conceptual gaps that affect all members of society. So for example, both the person doing the sexual harassing and the person being harassed suffer from this. So they both don't have a word for what's going on. But these gaps create asymmetric disadvantages, right? So the harassed person here suffers more. They cannot understand their own experience. They cannot make themselves understood to others. And this implies an impossibility of retribution and acknowledgement. And it can be that we have sort of global conceptual gaps, for all sorts of reasons, right? So let's say that there is somebody suffering from some sort of rare disease and we just don't know about it. We don't have the concept and the diagnosis yet. That would be sort of unlucky, but not necessarily an injustice. So these global conceptual gaps are unjust if they result from hermeneutical marginalization. So that would mean that there are certain social groups that are excluded from or underrepresented in meaning-making activities. So those practices where we create meanings and new conceptual resources and update our conceptual resources, like, for example, journalism, science, law, politics, or philosophy. Okay, so and just briefly, some further developments. So Gail Polhouse has argued for an idea she calls willful hermeneutic ignorance. So this would be a kind of hermeneutical ignorance where the conceptual gap actually isn't global, because new conceptual resources are developed by marginalized groups, such as the concept of sexual harassment was in the beginning during the second wave of the women's movement, but these are deliberately ignored by the mainstream or by more dominant speakers. And Christy Dodson has a very similar idea. She calls contributory injustice, so where marginalized groups develop conceptual resources which are not taken up by the mainstream, which she argues is a form of epistemic oppression. Okay, so, and then this work on epistemic injustice has very fruitfully been applied to the world of medicine and healthcare. In particular, the work of Ian James Kidd and Javi Carrell has been seminal here. So they have coined the term of pathocentric epistemic injustices. And for example, have they argued that patients with chronic somatic illnesses also suffer from epistemic injustices. For example, they suffer from testimonial injustices because of negative stereotypes and prejudices of patients as emotionally compromised and cognitively impaired because of being ill, right? So the idea being that they are ill, they might be afraid, they suffer, they have obviously an emotional reaction to the state of being ill. So it is assumed that they can't think straight. And there are also sort of more broader public conceptions of illness sometimes as some kind of personal or moral failure. And these stereotypes and prejudices lead to unfair credibility deflations and then to testimonial injustice in the end. Right. So, and then several people have applied this to psychiatry and argued that psychiatric patients are actually even more vulnerable to such pathocentric epistemic injustices. So they might suffer from classic testimonial injustices, being disbelieved, the testimony discredited in all sorts of contexts in everyday life and in healthcare. There can be preemptive forms of this, for example, when they are excluded from participating in certain practices where they might have relevant things to contribute, or they might suffer from hermeneutical injustices, right? So difficulties in communicating their experience, either because there are global gaps, right? So when we don't have a diagnosis and a concept of postpartum depression yet, or when there are sort of non-dominant resources being developed, like the linguistic resources created by the neurodiversity movement, but these are being ignored. Okay, so that was sort of the general background on epistemic injustice. And I wanted to give one example of how this applies to people with mental illnesses. A bit of recycling of older work of mine. So if we assume that there are stereotypes about and prejudices against people with somatic illnesses, this is definitely even more prevalent with mental illnesses, right? So common stereotypes here would include beliefs that people with mental illnesses might be unpredictable and violent, that they are somehow responsible themselves for what they are going through, so they might be blamed for developing some sort of mental illness or for not being able to snap out of it, or they might be considered incompetent, so they might not be trusted to actually deliver good work or to live independently. And all of this leads to discrimination on the behavioral level. So it might be that because of such prejudices, people with diagnosed mental illnesses have trouble finding employment, finding places to live, or finding doctors who believe them and who actually care about them. So one case study I have done has been on diagnostic overshadowing and it's a very catchy title. So diagnostic overshadowing in psychiatric somatic comorbidity, where I argue that this often involves testimonial injustice. So the starting point for this is that patients with mental illnesses in general suffer from excess morbidity and mortality rates with regard to some common somatic diseases, so like cardiovascular problems or cancer. And one contributing factor here seems to be the substandard level of physical health care they receive, including diagnosis and diagnostic error. So diagnostic overshadowing here refers to the tendency to attribute somatic symptoms to a previously diagnosed mental illness, which then leads to misdiagnosis or delayed diagnosis. And so just to illustrate this a bit, these are the life expectancy rates among psychiatric patients versus the general population in some of the Nordic countries. And you can see it gets a bit better over time, but it is still somewhere between 10 to 15 years of lifetime that they lose due to somatic diseases. And so obviously this is when we think about why this is the case, this is a multifactorial situation. So there might be like lifestyle related factors, so high rates of smoking, drinking, poor diet, obesity, that interact with socioeconomic factors such as poverty, unemployment, marginalization, and other explanations that have been proposed sort of relate to treatment and illness. So it might be that some of this comes down to side effects of psychotropic drugs, that there might be some common genetic risk factors for mental illnesses and somatic illnesses. There seems to be a lack of access to physical health care for those living with mental illnesses in many contexts. And it also seems to be the case that people with mental illnesses, even if they would have access to physical health care, utilize it less. And then lastly, there is this phenomenon of underdiagnosis and also sometimes undertreatment of physical diseases when treating psychiatric patients. So, and this would be this phenomenon of diagnostic overshadowing. Right. So, and I've looked a bit into like qualitative research that has been done on this. So interviews with patients that shows that diagnostic overshadowing leads to, for example, delaying physician visits and thereby underutilization of healthcare. So this patient said, I've stopped going to my GP. I keep having blackouts. I can't breathe sometimes. I think, what's the point? Because they look at you and say, oh, it's down to panic attacks, when you personally know that it isn't. It leads to self-stigmatization or anticipation of stigmatization. But you think, as soon as they get to know about this mental health diagnosis, I'll get worse treatment because I'm not worth as much in society. And it leads to self-doubt. So actually all patients that have been interviewed in this particular study describe previous experiences of not being believed and not being taken seriously. And this, in combination with their own thoughts about psychiatric disease, sometimes made the patients doubt whether their somatic symptoms were for real. And this then, again, contributes to them actually not going to the doctor. Other studies have interviewed clinicians on this. So clinicians working in somatic healthcare contexts. And those often also actually report or reveal effects of stigma and stereotypes. So to quote, I think sometimes we focus too much on the mental illness more than the physical. So if a patient comes in and they've got mental problems, like they come in with a broken leg, then we probably focus more on the mental illness and the broken leg. And this might sound a bit exaggerated, but there actually was a case with a broken leg in the literature that then sort of got dismissed as a psychological issue. Or another clinician said, we put it down to the person being a bit overly dramatic through his or her psychiatric problem. And this belief that the psychopathologized will exaggerate their somatic symptoms, that shows up a lot, or also that clinicians try to avoid people with psychiatric diagnosis in their chart, or at least try to keep the time of contact as minimal as possible. So in this paper, I argued that diagnostic overshadowing constitutes at least two kinds of testimonial epistemic injustice. So it might be sort of the classical kind, but coming down to prejudices, but this might also be greatly exacerbated by sort of structural features or conditions of the healthcare system. So when people working in somatic healthcare, for example, might lack psychiatric education, or they have very high patient loads and work under a lot of time pressure, so they don't actually have the time to really listen to people. Yeah, this will make sort of this problem worse. Okay, so that was epistemic injustice. I think that was the longest part. So, and then with the notion of epistemic trust, it's first of all, or at least it's common in the tradition of analytic philosophy to distinguish between trust and reliance, because I can rely on somebody even though I don't trust them. For example, if I have ways to control their behavior, or I can count on them acting in a certain way because it's in their best interest. So as an example, let's say I'm in a monogamous relationship and it's very important to me that my partner does not cheat on me and is faithful to me. And I might try to ensure that by sort of minimizing any contact he has to the outside world, or by controlling all of his social media, or secretly checking his phone, so at least I would know about it. This sort of thing, that is not trust. It might put me in a situation where I can actually be sure he's not cheating on me, but trust would obviously look different. So trust then is thought of as being more than reliance. And Adbaya, for example, famously has argued that trust involves reliance on someone's goodwill towards me. Sorry. Right. So because trust is not just reliance, it is at least partially blind, right? So I trust in a situation where I don't have full control. So it requires some leap of faith of me. And this is why trusting also makes me vulnerable. At the same time, it enables cooperation and maybe better relationships, while also saving resources, right? So it can save me a lot of time and energy if I don't have to permanently or constantly check on my partner and so on. And trust relations so don't just involve empirical predictions, so me sort of predicting that my partner won't cheat on me, but also normative expectations, so that he shouldn't be doing that. And therefore trust can be betrayed, and it also has an emotional dimension. And I think Karen Jones has put this very nicely. She says that trust is an attitude of optimism about the competence and the goodwill of the one trusted. So it's sort of a very peculiar emotional state where I am in a situation in which I am very vulnerable, but at the same time I can feel safe in this situation. Okay, so, and then trust is a three-part relation. So A trusts B with X, right? So I might trust somebody to drive my car, but not to take care of my kid, or the other way around. So I trust people with certain things or goods. So we might then say that A trusts B with X means that A has an attitude of optimism, but no guarantee and no control, that B is competent to provide X and also sincerely cares to provide X. So that will be the goodwill condition. And then with epistemic trust, sort of the only specific thing is that here the X is an epistemic good, right? Such as information I need, scientific inquiry on a particular problem, diagnosis, treatment proposal, things like that. So here is it A trusts B to be sufficiently competent and sincere or caring to provide them with the epistemic good. An epistemic trust can be rational or warranted, even though it's partially blind, depending on the evidence A has for B's competence and sincerity or care. Okay, so unusual in this, in this discussion of the notion of trust, interpersonal dyadic trust is taken to be paradigmatic, and then trust in groups or institutions is modeled after this. And I think there are lots of interesting philosophical questions come up there. There are definitely also interactions. So where, for example, my trust in my doctor can be supported by and itself enforce my trust in medical science or the healthcare system, or the other way around, right? So if I make a lot of negative personal experiences with my doctors, it might undermine my general trust in medicine. And we can also think of sort of general climates of trust and distrust that these individual interactions are embedded in. So where we might feel safe or unsafe to trust as a default. Okay, so now we have epistemic injustice and epistemic trust. So epistemic trust injustices. As I said, Graswick proposes this concept in the context of a discussion of various forms of epistemic injustice in science. And what is particular or special about epistemic trust injustices, that in contrast to the other epistemic injustices, they affect people not as contributors to, but as receivers of knowledge. And so Grasswick describes it as such. Epistemic trust injustices occur when, due to the forces of oppression, the conditions to ground one's trust in experts cannot be met for members of particular subordinated groups. And so this concept of epistemic trust injustice then seems to have three conditions. So first of all, B provides an epistemic good that is relevant to A, but A has good reasons to distrust, or at least lacks good reasons to trust. Either B's competence or B's sincerity and care, and A's reasons for distrusting B stem at least in part from A's social oppression. So in this situation, A cannot have warranted trust in B, despite B actually delivering X. So A can thus either be rational and distrust B in accordance with the best evidence, or they can access X, right? So this creates a dilemma for A. So, and now with this in place, I would like to sort of look back and apply this to this story of the boy who cried wolf and see whether it actually constitutes an epistemic trust injustice. So I trust B with X. Here would mean that the villagers trust the shepherd boy to provide true information about predator threats, right? So the first condition would be that B provides an epistemic good relevant to A. And this condition is met, so there actually is a wolf and the information wolf is relevant to the villagers. So for example, it might be because it's their sheep who get killed by the wolf. And A has good reasons to distrust B's sincerity in this case, right? Because the villagers know that the shepherd boy has lied about predator threats before. But the third condition isn't met, so that A's reasons for distrusting B stem from A's social oppression, because the shepherd boy here is not in a position of power or of oppressing the villagers, right? And this is not the reason. So they don't trust him because they don't distrust him because he has been oppressing them. So it's actually not an epistemic trust injustice because this condition of social oppression is not fulfilled. But the other two conditions are, so there still is a problem, and the problem has exactly the same structure. The villagers cannot have warranted trust in the shepherd, even though he tells the truth this time. So they can either be rational and distrust the shepherd based on their evidence, or they can receive knowledge about the threat to their sheep, right? So it's the same sort of dilemma they end up in. So, and as I said, so I think this then might not be an injustice, but it still puts them at a disadvantage that seems unfair or at least avoidable. So I would say that the villagers here suffer from an epistemic trust disadvantage. Okay, so then we have epistemic trust problems in sort of two variations. Epistemic trust injustices, where the reasons to distrust stem from or interact with social oppression, and epistemic trust disadvantages, where the reasons to distrust are independent of social oppression. And then one more point on this. So Grasswick's epistemic trust injustices or disadvantages are diachronic in nature. So the reasons to distrust stem from the history of interactions between A and B. And Grasswick says that A can have good reasons to distrust B if, for example, there is a history of failure to provide significant knowledge, right? So for example, there might be a history of getting it wrong with regard to certain areas. For example, here is research on female sexuality that has been riddled with lots of sexist assumptions, and biased results. Or there might be a history of systematic ignorance of the needs of certain populations. So, for example, if we think about the tradition of androcentric research in medicine, or there might be problems with the sincerity and care condition. So when there is a history of ethical and social injustices in the production of knowledge. For example, when there were unethical experimentations on Afro-American populations, like in the infamous Tuskegee trials. These constitute good sort of historical reasons to distrust the provider of knowledge in this case. And I think there might also be synchronic forms of this problem, right? So synchronic epistemic trust problems occur where there is a wealth of incompatible information that includes true information, but I have no way to figure out what actually is the true information. So one extreme example from this sort of literary example for this would be The Ministry of Truth in Orwell's 1984, that publishes contradicting news all the time, right? So one day the country is at war with another country and always has been so, and the next day it's the other way around, sort of. So obviously this then is not a trustworthy source, but we might have a similar situation when we have a variety of sources, but it is unclear which of them to trust. So it might be because we don't even know what the sources of particular informations are, or we don't have enough clarity about the trustworthiness of the sources. Okay, so then these epistemic trust problems come in two forms, diachronic and synchronic. In the diachronic case, it's a history of interactions that provides reasons to distrust, and the problem seems to lie somewhere with the proper updating of beliefs about trustworthiness. So any kind of solution would need to provide reasons for updating beliefs about trustworthiness. In the synchronic case, the problem is an overload of conflicting information. So the problem here is that one lacks a proper filtering mechanism to figure out which information I can actually trust, and the solution would somehow need to provide such filtering criteria or procedures. Okay, so with all that in place, I then wanted to think about how this might apply to people diagnosed with mental illnesses. I will try to keep this brief. So first of all, there might be lots of situations of sort of synchronic epistemic trust disadvantages. So let's say my child is diagnosed with ADHD, and I do a bit of research on that, and immediately I made like an overwhelming amount of information that often contradicts one another, right? So some people might tell me ADHD doesn't even exist, it's not a thing, or it's just normal childlike behavior, or it actually is a brain disease, or it is some sort of chemical imbalance. It definitely is a medical condition. There might be different or conflicting advices about what to do about this, right? So should I give my kid medication? What kind of medication? Should I try to tackle this with behavioral techniques and training? Or should I give my kid some kind of nutritional supplements? Do I need to put him on a gluten-free diet or on a low-carb diet, and so on? And I might also be confronted with conflicting information about the causes of this problem, conflicting explanations. So, I mean, obviously, this sort of thing will happen if you Google a diagnosis like that, but it might also be that you're in contact with different or several health professionals that give you conflicting information, right? So one doctor might describe the problem as one of chemical imbalance in the brain, while the next tells you that this is actually, out of date, sort of. We don't think about mental illnesses like that anymore. So then it might actually put people in positions where it's really difficult for them to figure out whom to trust. And if we look at diachronic reasons for distrust among people diagnosed with mental illnesses, I think we can fill all of those potential fields. So there might be a history of getting it wrong. For example, somebody might have gotten a variety of diagnoses in the past that turned out not to be a real fit. They might have been offered lots of treatments that were unhelpful. They might have been offered conflicting explanations that change over time. There might be a history of ignorance. So, for example, maybe certain concerns remain unacknowledged and not taken serious, right? So, for example, I don't know, psychological effects of being an immigrant in a foreign country, having daily experiences of racism, and so on. You might have a patient that has a history of experiencing other injustices or unethical treatments. So, for example, experiencing violence in nursing contexts, involuntary treatments, being given insufficient information about side effects of treatments. And a particular case of this would be having a history of other epistemic injustices. So having repeated experiences of not being believed and not being taken seriously can constitute sort of good reasons to actually not trust the other person as a provider of knowledge. So, and I think this can sort of create reinforcing cycles or vicious cycles. Right. So, for example, if we look back at this example of diagnostic overshadowing, it seems to me that experiences of diagnostic overshadowing actually constitute good reasons to distrust the medical system, or at least individual doctors, depending on how expansive these experiences have been, because clearly there is a history of getting it wrong in terms of misdiagnosis or delayed diagnosis. And there is a history of epistemic injustice, so testimonial injustice, which gives me reasons to doubt the doctor's competence and sincerity and care for me, right? But this might then lead to me losing out on epistemic goods that are actually very important for me, like having a timely diagnosis. And this may lead to delayed treatments, lower treatment compliance on my side, and to detrimental health outcomes. And the last consequence. Yet I think it's important that, so it might seem that patients are being irrational if they don't go to the doctor, even though they clearly have some sort of physical problem, but they might actually not be irrational there if they distrust or even avoid contact with the medical system based on the previous experiences, because they are in this sort of dilemma that epistemic trust injustices create. Okay. And this is the last point. So previous experiences of epistemic injustices then can affect the conditions for warranted epistemic trust. Because so if I suffer from testimonial injustice, this means I cannot transmit my knowledge to the hearer, right? So then the hearer fails to receive relevant knowledge, and I know that of them. So this gives me a reason to also distrust them, I think, as a contributor of knowledge, because if he is unable to listen to me because of prejudices, I might assume that they also have systematic blind spots and biased views in other areas, right? So I have a reason to distrust them. If they then provide me with actual knowledge or true information, I might fail to receive that knowledge from them because of that distrust. Because of this, they will know me to be less knowledgeable than I could be because I'm not learning from them. And this, again, decreases my credibility and increases the likelihood that my future testimonies will also be dismissed, and so on. So I think this is actually maybe not even just a vicious cycle, but a downward spiral where it gets worse and worse over time. Okay, so, right. So I don't have any like ready-made solutions for this. I just wanted to say a bit about what the structure of a solution should look like. So if you have somebody suffering from an epistemic trust injustice or disadvantage, and you want to make them trust you or science or psychiatry again, it's not enough to just now provide good, valid, accurate, true information to them, right? Because the problem stems from a lack of reasons to trust the source of the information. So you need to give people reasons to believe in the source's competence and sincerity and care. And for seeing chronic disadvantages or injustices, those reasons need to point out why this source is better than others. And diachronic disadvantages need reasons pointing out that something has actually changed for the better. So, for example, the shepherd boy needs to make the villagers believe that he will not lie again, right? And to do so, like minimally, he will have to like take responsibility for his behavior, apologize, maybe make up for it somehow. And he will also have to prove himself over time. So this will not be an immediate fix. And I think here it's also important to acknowledge sort of the affective, emotional dimension of trust relations, because these can explain why distrust is often very sticky, as Catherine Furman has also argued, because restoring such an optimistic attitude towards one, once the trust has been betrayed, can be very difficult. And even with epistemic trust, so when it's just about epistemic goods, the problem always runs deeper than just sort of rationally updating one's beliefs, because it has these emotional and moral components. Okay, so this then is my last slide. So just a few sort of takeaways from that. Epistemic trust injustices create a dilemma of either being rational or receiving some particular epistemic good. And such trust issues need to be addressed, not just on the level of the epistemic good, but of the reasons to trust someone. And epistemic trust too has cognitive, obviously, but also moral and affective dimensions. Epistemic injustices can create a downward spiral. And I think the psychopathologized are particularly vulnerable to such injustices and disadvantages. So first of all, because they are particularly vulnerable to suffering from epistemic injustices in all sorts of contexts, and they might also just more often find themselves in situations where there actually is a need to trust, for example, in all sorts of healthcare contexts. Okay. So thank you for your attention.
Thank you very much for this intriguing and very rich talk. So yeah, I will stop the recording.